Hello, my friends. Welcome to another episode of Up Ovo podcast. In today's episode, I'm going to talk about electroconvulsive therapy. So let's go. So, electroshock or electroconvulsive therapy, or simply ECT, often gets associated with some pretty intense or even scary looking scenes where it's used to pacify challenging patients. Well, a stereotype we can mostly blame on Hollywood. Well, movies set in psychiatric hospitals, we'll think of One Flew Over the Cuckoo's Nest or Girl Interrupted, tend to show ECT right alongside other, to put it mildly, controversial treatments like, for instance, lobotomies. But in reality, ECT is still widely used today with solid results in modern psychiatry. And of course, the actual procedure these days is a far cry from the horror movie version. But before we get into how it's done today, let's cover a bit of its background. Well, ECT has a long and pretty complex history. Well, in fact, compared to other psychiatric treatments, it's one of the best studied. The original idea was to use one condition to treat another. And this approach had already been explored for neurological symptoms of syphilis. And in this case, malaria was the treatment and syphilis was the illness to be cured. And of course, syphilis treatment has changed drastically since the early 20th century. But in the 1930s, let's say, many psychiatric conditions and infectious disease were still incurable. So, Hungarian doctor called Ladislas Meduna noticed something interesting. Well, brain samples from patients with schizophrenia showed a lower concentration of microglia compared to patients with epilepsy. Well, microglia is a type of central nervous system cell linked to some mental disorders. I mean, the activation of microglia is linked to some mental disorders. So, people with schizophrenia showed lower concentration of microglia and people with epilepsy showed higher concentrations. So, Meduna thought that maybe seizures in epilepsy could somehow treat schizophrenia. So what he did, Meduna tried something new with a patient suffering from catatonic schizophrenia. It is a form of schizophrenia where patients stay frozen in one position for hours, sometimes in awkward or rigid postures and sometimes in the regular positions. However, they are frozen in one position for a long time and they don't respond to the world around them. So you may get a feeling they don't hear you, they don't see you, you can touch them, but they don't react. So they are literally like frozen people. And Meduna gave his patient an intramuscular injection of camphor, which causes tonic-clonic seizures, where tonic-clonic seizures is basically a full-body epileptic seizure. And while the first attempt didn't cure the patient, after several rounds, she started walking, she started talking, she started eating again, with significant improvements in her condition. Well, the camphor method worked, but caused patients serious side effects like a racing heart and intense fear in the patient. So the search was on for a method that would cause fewer side effects. And that's where a team of Italian doctors proposed using electric currents instead of camphor. Well, this method with electric currents, well, unlike injections, caused an immediate seizure. So the seizure wasn't delayed, as in camphor injections. And also, electric shocks didn't have such harsh physical reactions. Well, their initial approach involved placing electrodes in the mouth and in rectum, but early trials conducted on dogs showed that this setup sometimes stopped the heart, so they shifted to focusing electric impulses on the head only to avoid heart problems, and in general just to avoid killing the patient. Well, the first official ECT trial on human was around 1938, and the patient was a man in his 40s, so he was 40-something years old. He was diagnosed with schizophrenia, and he was found wandering around a train station in Rome. And after a few sessions with 110 volts, the patient showed fewer psychotic symptoms, and he was able to go back to a relatively normal life with his family. So he could keep his household, he could live with his wife, he could even go back to work. So basically, he started to function pretty normal. Well, the ECT was a major breakthrough for psychiatry, which had seen few advancements for a really, really long time. Unlike surgery, unlike anesthesia, well, in psychiatry, nothing interesting has happened for a long time. So it quickly spread across Europe and North America and was officially adopted for schizophrenia treatment in 1940. So just 2 years after the first trial on human, it has officially became the legal treatment for schizophrenia. Well, soon it was also used for severe depression, some neurological conditions, and even somewhat optimistically for psoriasis and ulcers. Though effective, the method had a major drawback. Well, patients weren't given anesthesia or muscle relaxants, so the electricity caused full body convulsions. Even though the electrodes were placed around the head, well, the electricity caused the full body convulsions. Well, patients were, of course, strapped down with something soft in their mouth to prevent biting their tongues, but the convulsions often led to painful muscle spasms or even broken bones, especially in the arms or spine. And also, from the cognitive standpoint, it caused memory loss and other issues affecting both past memories and the ability to learn new things. So, in the 1950s, in the early 50s, and to be very specific, in 1952, well, things improved when anesthetics and muscle relaxants became standard for ECT, while making it much safer and much more comfortable for the patient. And this updated approach remains the basis of ECT today. Well, though of course, it's continuously refined. Well, newer techniques like transcranial magnetic stimulation also use electrical impulses, offering additional options for patients. However, in general, ECT in the form from 1950s is still used. Well, nowadays, ECT is primarily used to treat severe depression, especially treatment-resistant depression. Because sometimes, despite the wide range of medications available today, well, symptoms just don't improve. And this is when ECT can make a real difference. So instead of giving our patients hundreds of pills, the doctors and psychiatrists can just use ECT to see if there's any improvement. Well, I remember a patient, a young man, he was about 30-something, 35, maybe 36. And this patient came in with such severe depression that he was practically living in a fog, moving between bed and chair with no interest in anything. He didn't care about his own life. He didn't care about his family. He didn't care about his wife or his job. Really, nothing could make him laugh. He didn't smile. Really, he was barely reacting to anything. And after the conversation with the doctor, he agreed to try ECT. And believe me or not, after just one electroconvulsive therapy session, he was almost like a new person. We're alert, engaged, ready to move forward. Well, he even said that if he'd known ECT would help like that, he'd have asked for it sooner. So it was like a magic wand. And of course, usually one ECT session is not enough, but I saw it with my own eyes that this first one session could really, really help the patient. Well, ECT is also used for schizophrenia, bipolar mania, and even for dementia patients with aggressive behaviors. So older people diagnosed with dementia who display aggressive behaviors, they can be treated with ECT, and this is also very, very effective, very efficient method. Well, a lot of people are surprised to learn that ECT is often one of the safest treatments for pregnant women, because psychiatric meds can be a bit risky for fetuses as they cross the placental barrier and can lead to developmental issues. So, for example, antidepressants like paroxetine are linked with higher risk of heart defects, and long-term benzodiazepine use can lead to breathing problems or other complications in newborns. And while some medications can be safe during pregnancy when necessary, in certain cases, ECT can be a better alternative and offering effective treatment without the same risk to mother and baby. So basically, there's no need to be scared of either medication or ECT during pregnancy, because both have their place in ensuring well-being for mom and the baby alike. And well, basically, this is all what I wanted to tell you about electroconvulsive therapy. Well, I hope you found this episode interesting. And if you like it, you can click the like button. Although I have no idea how the YouTube algorithm works, so I don't know if that matters. However, it is nice if you click it. So thank you, and until next time, bye bye.